It is Columbia Morning on KFRU. I mentioned in my promo for today that October is Depression Awareness Month, and we have a psychiatrist from the University of Missouri Medical Center there, and he is going to talk to us about some of the treatments that are involved in this. And also I'll introduce to my listeners right now Dr. Muaid Ithman. It's nice to meet you, sir. How are you?
Thank you very much.
Let's talk about depression and especially about being aware of some of the symptoms that might help people understand themselves or others around them better. When we're talking about depression awareness, what do we need to be aware of?
Depression is one of the most common psychiatric illnesses. About 17 million people in America will be affected at least once in a year with this illness. It is a component of multiple symptoms, but the main symptoms, at least in a definition, is a depressed mood or loss of interest for at least for 2 weeks. However, it can creep before that also, so people could feel the loss of interest, loss of ability to function, fatigability, headache before that.
So we're going to talk about some treatments for it in just a moment, but you talk about the number. Is it does it run in families? Does it not run in families? How do you what do you look for when you're looking to see what might be the origin or cause of this?
There are different reasons, and it's not very well understood, but still there's what we call the biopsychosocial component to it. So the biological part of it is there is a genetic factor, so it runs in families. So if the person has a strong family history of depression, their chances is more to have that depression. So a twin study showed that when a twin has a depression, there's a chance of more than 40 to 50% to have the other twin to have depression there.
I think one of the challenges is for us to be able to talk about this and talk about it in individuals' lives or in families without feeling some sort of embarrassment or some sort of a failure there. How do you address that? Because I hope that in 2019, maybe it's a little bit different than it would have been in 1999, 20 years ago. Are we getting better at dealing with this as a society?
I think so. I think we are dealing better. I think people are more open about it, coming and seeking help. I think our message in this field that depression is an illness. Depression is like any other illness in the field of medicine, and it is treatable. So it's not something that we need to hide. We need to ask for help from the beginning and not to let this illness to take over our lives.
It's still difficult, though, isn't it? For many people that I'm sure you talk to many people who say, well, I just can't admit this to others, excuse me, or I don't want to talk about it.
Definitely it is. It takes time. And the problem with that is sometimes it does not really show itself as depression in the beginning. As I said, it shows sometimes with somatic symptoms. So, people can go and seek for headache, chronic fatigability, poor sleep, or they feel that they are edgy than before. So it really does not show at the beginning, and it needs high index of suspicion when to look for such symptoms.
So what advice do you give to people if they feel like maybe, I don't know whether I'm depressed or whether I would have a diagnosable depression or not? What do you tell people?
I think it's to be open, talking about it, seeking help with their providers, like the primary providers, talking to their family and friends, and also seeking mental health. There are a lot of places that they can go and ask for it, but primary, talking about their primary providers and asking help as soon as possible.
If I were to answer like a test question on what are the common treatments for depression, I would say probably counseling, meeting with a psychiatrist like yourself, or I would say there are also several prescriptions. What am I missing out if I say those are the only ways that people are dealing with depression right now?
I mean, getting to the psychiatrist at the beginning is going to be very, very difficult. So for the first line is going to be the primary providers, mm-hmm. and the primary providers usually they do a good job in screening for that. There's also self-screening questionnaires that they can do that, like the Beck inventory, which is very easy to screen and look into that, and then you can find the next level to go to a psychiatrist and the counseling.
How successful is counseling dealing with depression?
It is very successful. It's one of the first line of the treatments also.
about how long? I know every individual is going to be different. Every situation is going to be different. Every illness is going to be different. But what is once struggling with depression, rest of the life going to be struggling with depression? How do you look at that as a psychiatrist?
Actually, it depends because, if this is the first time you're suffering from depression, recommendation is to treat at least for 6 to 9 months and then reevaluate there. If this is your second time, it's going to be longer. But if it goes more than that, this is your third or fourth depressive, most of the time it's going to be to put you in a maintenance treatment.
What are some of the treatments aside from counseling, aside from working with a psychiatrist or a psychologist? What else exists now? I mean, we see some advertisements on television, for better or worse, about some of the medicines that are available. We can read about these, but are there new developments? What do you see as far as other treatments?
Definitely. I mean, we have been advancing, quickly in the field of psychiatry. The gold standard treatment is counseling and antidepressant. And however, unfortunately, about possibly 30% of people who treated for depression will not achieve a meaningful clinical output with these treatment, and depression will run in a chronic shape, causing the burden on the patient and their families. So looking for alternative treatments would be an important thing, and there are different alternative treatments available that can be offered for such people. And one example of these alternative treatments, like a neuromodulation treatment, and most recently, a newer antidepressant was approved by the FDA in March 2019, which is the S-Ketamine.
And what is that? I don't know what's the different about this.
The S-Ketamine is a new antidepressant. It is a derivative of the ketamine, which is an old anesthetic, and it's not a new medication, but it's as an antidepressant. It has uniqueness and it is different mechanism of action compared to the available antidepressant, which all works on a monoamine transmitters, which is, the serotonin, dopamine, and norepinephrine. This works in a completely different neurotransmitter, which is the glutamate. And also, the uniqueness about it is very rapid action. Most of these antidepressants, when you go to psychiatrists or your primary, they can give you the antidepressant. They will tell you, take it, wait, a couple of weeks to work, and then at least 4 to 6 weeks to see the effect of it. A depressed person working that long, and then it's not showing an effect, and then has to wait another 4 to 6 period of time of waiting for a depressed person and the burden of it. While this medication works within hours, actually, and the relief can be there. So even if it's not a cure, but it's a very valuable tool now that we have that can help those people to lift that depressive symptoms in a very quick and effective way.
Help me understand before I have to let you go, something that you mentioned, which is neuromodulation. I don't know what that means.
Neuromodulation is utilizing electrical current or magnetic field to stimulate the brain to deal with psychiatric illnesses. There are different kinds of neuromodulation. There are the invasive and non-invasive. The non-invasive is like electroconvulsive therapy, transcranial magnetic stimulation, where we use the magnet to stimulate the brain, and there are different invasive kind, like the vagal nerve stimulation. And one of them is transcranial magnetic stimulation that we have been utilizing at this point at MU Health also, and it's very effective and safe and non-invasive.
So what's your bottom line here? What would you leave people with?
Well, my message will be, depression is treatable. Please seek help, and whether at MU Health or other places, we're available to help. And MU Health will always seek the cutting edge of treatment. We have all the advanced treatment at this point available at our facility, and we are here to help and be there to take the responsibility to help the people with depression.
Do you think primary care physicians are doing a pretty good job of screening?
I think so, and I can talk that from my experience because we have been receiving a lot of referral from them to the neuromodulation clinic that we have, and I'm very glad to see them sending these patients.
Doctor, I appreciate your time today.
Thank you very much, David.
It's October is Depression Awareness Month. Psychiatrist from MU Healthcare, Dr. Muaid Ithman, has been our guest. It's Columbia Morning. This is KFRU.